In this video, I'm going to be talking about vaginal tearing during childbirth, particularly how I avoided vaginal tearing and how I helped many others avoid it as well. I'm Dakota Smith. I'm a nurse, childbirth educator, and mama of 2 little ones, both of which were born at home. And I've helped over 200 other moms go into labor feeling confident to birth their babies and prevent tearing while doing so. By the end of this video, you too, hopefully, will feel the exact same way. So I'm going to cover 3 key methods that I use to protect my perineum, what I avoided, and what I did instead. If you want an extended list of the methods and strategies that I use to prevent tearing, be sure to check out my free masterclass on tearing, which you can find in the link in the description below this video. So the 3 key ways to prevent tearing. Number 1, skip the epidural. Many moms often opt in for the epidural simply because they don't want to endure the immense pain that comes with pushing out a baby, and that is totally valid. However, it is not that simple. You should understand that opting for an epidural comes with its own list of potential problems and complications that probably will not be laid out for you at the time that it's administered. So, what are those problems? The first and most crucial problem is that you lose control over pushing. When you have an epidural, you can't feel your contractions as intensely, meaning that you don't get that natural urge to push at the right moments. Instead, you're often coached to push on command, which can lead to forceful, prolonged pushing, also known as purple pushing, and this puts excessive pressure on your perineum and increases the risk of tearing immensely. The second problem with getting an epidural is the restriction of movement. Since you lose all feeling in the lower half of your body, you are most of the time forced to birth on your back, and even if you aren't forced on your back, even if you're laying on your side, you're not able to work with gravity as much as you would be if you were in an upright position. So if you are forced to birth on your back, this places the birth canal in a non-optimal position to push out the baby. This increase of pressure on the perineum makes it way harder for your body to stretch gradually, which increases the risk of tearing. Now, I'm not saying an epidural is always bad. It has its place, and for some women, it can be the best choice for their birth, such as those with severe preeclampsia or eclampsia, and in the case of a prolonged ruptured membrane or water breaking. But if that doesn't apply to you, and preventing tearing is a top priority for you, it is so important to understand how receiving an epidural will affect your body. So skipping the epidural is something you can do during labor to decrease your chances of tears, but what can you do before labor to prepare your body for stretching? That brings me to number 2, perineal massage before birth. You've probably heard before that perineal massage can help prevent tearing, but what exactly makes it so effective? And when is the right time to do it to maximize the benefits of it during birth? So I want you to think of your perineum like a balloon. If you try to blow up one right away without stretching it first, it will be stiff, resistant, and way more likely to pop. But if you've ever seen a balloon artist, they will always stretch and warm up the balloon first, pulling and loosening the material so that it's more flexible. And once it's been stretched, it will inflate so much more easily without breaking. That's exactly what consistently massaging your perineum does for your body. By gradually stretching and preparing the tissue before birth, you will end up increasing its flexibility and lower your chances of tearing when it needs to stretch the most. Not only that, but it also helps you get used to the sensation of pressure and stretching, which in turn will make it so much easier to relax and stay calm when you feel that same sensation during crowning. In order to get the best results, it's best to start massaging at the beginning of the 3rd trimester at the very latest, and to aim to do it at least 3 to 4 times a week. Here's how to do it effectively. Number 1, of course, wash your hands and use a natural oil. Coconut oil, vitamin E oil, or a water-based lubricant all work great to help reduce discomfort. And then number 2, get into a comfortable position for you. This might look different for everyone, but sitting up with your back supported against a couch or a headboard and using your bed to prop up your knees or just bending your knees works well also. So then you're going to insert your thumb about 1 to 1.5 inches into your vagina and apply a little pressure downward towards your rectum and out towards the sides. So you're going to stretch the tissue into a U-shaped motion while pulling down with your thumb. And then you're going to hold and breathe. So when you feel a slight burning or stretching sensation, hold there for 30 to 60 seconds. then release. This mimics the stretching feeling that you're going to experience during birth and helps train your body to relax through it. And then you're going to want to repeat for 5 to 10 minutes at a time. Do this 2 to 3 times a week, and then you can even increase the frequency if you'd like as it starts to feel more and more comfortable. But even if you don't do perineal massage, how you push during birth makes a huge difference. Let's talk about that. So number 3 is controlled, slow pushing. And you might be asking, is there a way to push that lowers the risk of tearing? And the answer is yes. So instead of holding your breath and forcefully pushing, purple pushing, focus on breathing your baby down. Slow, controlled, exhaling as your body naturally moves the baby lower. This gives your perineum time to start stretching gradually and reduces the risk of tears. Now, if you want an easy way to practice this before labor, I've put together a free guide on the best exercises and techniques to help you, and you can grab it in the description below.